thing. I'm like, hey, do you get college discounts? I use my badge all the time. So I try that. Anyway, I'm updating my medical history with my patient. You have to ask for that. Remember, every time they're in our chair, any changes in medical history. This is my first time meeting her, so I had to ask if she's numb. Hi.
Hi, Crystal. Sorry to interrupt.
No problem.
Just need to find out if you're loading. Welcome. Okay, thank you. And this Dell?
He's in row.
Okay, cool. Thank you.
Uh-huh. Since I just meted her, I want to make sure she's not going to be allergic to anything that I'm going to use. So what I'm going to do today is, so before I touch my patient, I'm not going to glove up yet. I'm going to put this in your hand. And I want you to chew this. You don't have to swallow it, so just chew it up. Okay, I'm going to give you this just in case you chew it up and make sure it touches everything in your mouth. Your tongue, your cheeks.
What is that?
This is my disclosing tablet. Okay, and go ahead and spit it out, what you have. And then you can rinse and spit out in your cup as well.
Kool-Aid, anybody?
So I dyed her teeth pink and purple. I am pulling out one of these. I'm pulling out one of your charts. I'm sorry.
It's okay.
So we need one of these for this case. So would you mind turning for me? All right. All done?
Yep.
All right. Go ahead and smile for me. All right, so I basically am disclosing any plaque or anything on the teeth because I want her to see if she has a problem area. Well, she brushed this morning, so I was trying to make sure nobody brushed, but I totally forgot last night to text somebody. So I'm like, don't brush. But anyway, she did say she was ate some stuff, so I just got a little bit of disclosing. So if she smiles with teeth, you can see a little bit of darker color. So I'm looking for the darker purple or a lighter pink. So if we're pink to purple, that means we have some sort of plaque or decay there. All right, so I'm going to tell my assistant to chart the area where she has plaque. So since she doesn't know what she looks like, let's give her the opportunity. All right, so next thing I'm going to ask her to do is brush her teeth in front of me. Well, in front of everybody. You don't have to do it properly if you don't want to, because this is just all education. You can be just like a little 15-year-old kid that is like, I don't want to really do it.
Without water?
Yeah. If you need the mirror, let me hold that for you. All right, she does a pretty good job, so we're just going to evaluate how she cleans right now. And do you use a manual toothbrush or an electric? Manual? Mm-hmm. And how often do you floss?
At least once a day.
Once a day?
Mm-hmm.
Every day?
Mm-hmm.
Okay, good. All right, so I'm going to stop her. Right about now, I'm going to glove up because I'm going to show her some things that maybe she doesn't know that she's doing. Pressure technique. I want to make sure I instruct her to have light pressure. And our bristles matter. So we want soft or extra soft bristles is the type. If you get hard, medium type of bristles, that means they're just tough and stronger. So the more pressure you put on those bristles, the more enamel you're going to start wearing away later in life. Okay, so we need light as a feather. Think of cleaning as a window. We clean window very gently, right? We spray with cleaner and we use a paper towel and we kind of smear. We don't press hard or we don't use any abrasive things on there. Why?
Could scratch it.
Because you'll scratch it or dent it, maybe possibly break it with the force. Same thing as teeth. So always try to give them something similar about teeth. So teeth are like glass. The more you press on it, the more you're going to hurt on it or fracture it or break it. The more you scrub, we're going to etch it or cause lines into the enamel. So we want to make sure that her pressure is light. So I'm just going to do a little demonstration. So you did perfect. You know, you're doing great circles. Don't forget to turn your toothbrush a little bit down, pointing towards the gingiva, and clean downwards as well. Or when you're up, clean upwards. So when you get these little bristles that are jagged, those bristles actually do that work. Now you see how these white, they were white, but they're purple now. So these are technically white in the top. Do you see how they're taller than any of them? Well, these are, if you didn't know, they're a little trick. Open wide. These are to clean here in your lower anterior area. And when you do circles, you can pull down and pull up as you rotate from canine to canine as well. Turn your toothbrush vertical and do the top. And we're just circling and pulling down at the same time. But you want to keep light as a feather, so no pressure. Good job. So now I'm going to ask my patient to floss. Good, she digs pretty good. So we say dig, because you want to go beneath the gingiva. So if my hand is my tooth and my sleeve is my gingiva, here, right? So you want to make sure you take your floss and you're creating a C shape, and you're going to go into that gingiva. And you're going to scrape a couple times here, and then don't forget to flip it on this other tooth and clean inside the gingiva. You have to make sure your patient is going all the way down. Some patients go in and they go out. So that's what I was looking for. So I couldn't really see because she's really tight, so I had to kind of hover over her. So remember, in dentistry, we don't have boundaries, okay, at all. So I'm going to hover over her because I need to see. Don't forget, I don't have boundaries either, because when I lay her back, she's in my area. Okay, so we don't have technically boundaries anymore. Kind of, we're in your grill. We're all up in your grill.
All of them?
No, you're good.
Okay.
You can put that there. All right. I'm going to lean you back. Nope, that's all right. Sorry.
You're fine.
All right, did you buy a season pass?
No.
It's all right. Hey, I don't know if it goes forward or backwards. Even though it
Just don't
says.
squish me like that. I'm good.
That's an ab workout.
Yeah. Or maybe do it a couple times. Might need it.
Looks like you're so far away. Lift your head for a sec. Okay, go back.
Okay.
All right, so I want to make sure that her head is technically right here. So you kind of want to stick your butt out and your back straight. If she kind of wants to be in this area, she's a little too high right now. That means I'm going to be like this.
Okay.
So you want to make sure she, now you don't have to move.
Okay.
So I got to move her for me. So this is about a good area to work where I look like I'm going to be relaxed. You never want to work too high or too tight. Because don't forget, you're doing this for 8 hours a day if this is your column today. All right, first things first, let's look at what we're going to chart. Okay, go ahead and open. All right, so tooth number 1 is technically missing. Tooth number 3, I have a little bit on the mesial. Tooth number 4, distal mesial. Tooth number 5, distal mesial. I'm just charting where I see purple. $14 missing. 16 missing. 17 missing. Class 5, gingival third on tooth number 18. The other side. Yep, that's gingiva. Is that a crown on tooth number 19? So, I have some on the mesial gingival area on tooth number 19. Occlusal, mesiopit and distopit, tooth number 20. And we got a bridge from tooth number 28 to, looks like 31. Wow, you got a 4-unit bridge. That's nice. Okay, open ring. Now we definitely need to clean under that bridge, that temporary. Temporary harbors a lot of stuff. Okay, so I'm back on tooth number 21, lingual. Gingival third, 20, lingual gingival third, mesial as well, and distal. Mesial gingival area on the lingual 19. Gingival area on tooth number 18. Tooth number 654, mesiolingual of 4, distolingual of 4, and mesiolingual of 3. And that's it.
I have a quick question.
Yes.
Okay, so like we did charting last month. Are you charting them as like caries? Or?
No, I'm charting. It should be red. So basically, when you see this chart, so when you see this chart, you see all the markings she has. That's where she maybe has cleaning areas.
Okay.
You know what I mean? So
Yeah.
we're going to pretend she didn't eat and she didn't brush.
Okay.
Okay, so this is just cleaning area diagram of
Okay.
where plaque is seen.
Okay.
So most of it's honestly between the teeth.
Mhm.
And only on her molars. So upper right and upper upper right and lower left. So sometimes in this area you're not as efficient because your same hand. Maybe you should alternate hands. Try using your left hand on your upper right and use your left hand on your lower right. Maybe your dexterity, are you right-handed? Maybe it's not angling this way because it's on the same side. And the only reason why I know that is because it's like an X, remember? It's just like x-rays. So if you can work here, you work here. So if there's an issue just right across the mouth. So maybe it's the hand. So switch your hand. So maybe that one's going to learn how to manipulate the areas that you need. And this can take habit. So you got to always tell yourself, you know, circle, 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 turn towards your, you know, towards the gums. Oh, now I got to switch my hand. So it's going to take a habit. So you got to change your habit. So it's all a habit. If you don't change it, you're going to be the same way you are. Got my glasses. Okay, I'm going to start Prophy. Remember, the key speed is 20 miles per hour.
Can I write that down?
This is our Prophy paste, and it has grits inside of it. So the more staining you see on your patient, the bigger the grit. So we have small, fine, extra fine, coarse, medium. Those I'm talking about grits, like sand. So sand is basically kind of in here. We call it pumice. So the type of grit you have for the more staining. So if she had a lot of staining, I would either go to straight pumice, which is like total sand, to remove. Because coffee drinkers, do you drink coffee? Tea, coffee drinkers, staining, things like that, they have that issue. So you might need a harder grit or more coarse. So just keep evaluating your patient on what type to go. Normally, everybody here is going to take a medium grit. That's what this is. So that's universal across the board. But you'll get, like, my grandmother drinks like 8 cups of coffee in a day. So she probably needs the extra grit. Does that make sense? So, okay, so then we have different types of staining. We have intrinsic staining and extrinsic staining. These are also Damon terms on them. So intrinsic, in means within the body. So we have antibiotics. That tetracycline is one that can, if you take it a lot, it'll stain your teeth gray from the inside. So it'll be gray from the inside, or systemically, meaning you ate it. So if you take tetracycline, that does that. Let's see, extrinsic means outside, so outside the tooth. So that's coffee, tobacco, tea, berries. Anything that stains a white shirt will stain teeth. So that's kind of how I tell my patients. Oranges technically stain. So anything that stains the white is going to stain your teeth. So now if we talk about whitening at this point, you know, we're going to talk about you got to lessen that stuff or intake more water. So every time you drink coffee, you're going to drink water after that to rinse it off your teeth because your saliva is not producing enough to rinse it. So that's why you're getting stained. All right, I'm going to open my Prophy paste, and I'm going to use my slow speed to loosen it or make it. Oh,
I told you something was a little off.
Thanks for a shower.
No problem. I didn't realize we were going to take a shower together. I gotta fix this water thing, so I'm not supposed to get water in this. We're both gonna get wet if we...
Why does that happen?
What, the water?
Yeah.
Because some hoses have water like our hand keeps, so you turn it up or turn it down.
Okay. So that can cause that extra...
Yeah. Hi.
Okay.
We're going to be at 109.
109? Okay.
Yes, ma'am.
Seniors. 109, 10 o'clock.
Bring all your stuff.
Okay. Now we got no water. Well, no, we could. Now I'm all wet. Yeah, so I'm going to show you how to use either the ring or, thank you. Okay, we're back in business. Minor difficulty. Okay, back to where I'm doing. Oh, it fell out. See how thick this is? That's the paste. So you gotta make it looser or more creamier. So I'm gonna stick my handpiece in there to stir it up to make it softer and easier to grab. Okay, so we have this funky little ring as well. You can put it on your finger, keep your Prophy cup inside of there, so it's easier to access when you're in the mouth. You can go from there to get it in there. 14 years I learned how to just hold it in my hand. So I put it in between like that, and I hold my mirror. Alright. So I got my Prophy cup full. You also want to make it flare. And I'm going to go inside that gum tissue just a little bit. 20 miles per hour and only 3 seconds on a tooth. So I'm going to take some and I'm going to wipe it on some cusps so I have enough Prophy paste for a couple teeth. You can press down. The pressure helps But when I talk about pressure, I'm not pressing very hard. It's just air. Okay, so I'm making like a U shape. So I'm kind of going into my gingiva, and I'm pulling down 3 seconds. And you hear my sound is not high. So if I go like this, that's high. That's like 40 miles per hour. Okay, so less than it. 20 miles per hour only. I'm pressing my cup to the tooth so it flares out just a little. And I'm scraping against teeth so I can have some Prophy paste on some teeth. Oh yeah, it's going to tickle, especially the palate. So I'm going to do your palate now. I do the quad or sextant. Sextant means about 6 teeth, and then you stop and do the lingual. So if you could do a quad or sextant, that's good. Tickle, sorry. All right, so I did a quad. I'm going to give my patient a break and rinse it. Make sure I'm pointing up with my bevel. I'm using the back side of my HPE to go in. All right, resume for the left quad. I always start on the back teeth, then the front teeth backwards. So we will practice this on Dexter before you practice on a human. Because if you go too fast, you can actually speed up too much and burn up the pulpal tissue.
Oh.
That means next thing she'll need is a root canal. Big. Tickle, tickle, I'm sorry. Do 2 more teeth and I'll give you a break. Continue on to my lower lip. As you notice, if I see my fingers on her chin, that's actually a fulcrum. You have to keep a fulcrum or else your handpiece will slide away from you. And then it'll jump, so you always want to make sure you're holding on like a pencil, like you're grabbing your paper. So fulcrum is a thing for this procedure. Open it. right, this is about only a half an hour procedure, so you want to make sure you get done in the allotted time. Don't forget, you also, at this appointment, you may have to take 4 bite wings and 2 PAs, because that's an update, or you've taken an FMX and we're cleaning for the first time. I'm going to give you some water like mouthwash. Go ahead and swish it around. Do it again. Make sure it's completely out. Swish. Alright, so I just completed my polish. I got Prophy paste and spots all over, so just do some courtesy, wet your gauze, and I'm just going to wipe your lips. Now I'm going to floss. So I have to floss my patient. So the way we floss, these are large gloves, I don't wear large. So you want to, your middle finger, you're going to tighten, not as tight, but you're going to wind up as much floss as you can on each middle finger. So like, let me make sure it's tight, stays. So now I have my pointers could point down, or I can use my thumb as well. So you can do a combination of both or both. Okay? So middle finger, you can tighten it on. So one's going to let loose, one's going to tighten. So every time I go in between the two, I'm going to loosen and then I'm going to tighten. Loosen, tighten, and then go backwards until I get the whole mouth. Don't forget the distal of the last tooth as well, because a lot of patients forget back there. So make sure you get inside that gum tissue for them. You're going to do a seesaw motion to get inside the teeth, because if you don't, you just pop it in, you can hurt that gingiva. So seesaw in, tight contacts, you're going to use that technique to go in. I'm making a C shape around my distal portion and a C shape around my mesial portion of each tooth, getting inside that gingiva all the way around. Got bridge there too. Okay. So if you can't get in, you got to investigate. I noticed there was a bridge there. Sorry. Let me snap that in there. You notice how I don't cross my hands? My hands stay open all the time. My back stays straight, so don't leave over your patient. Those are things you want to make sure you're continually checking yourself on, because your back, your arms, and your wrists are for longevity of work. So ergonomics is so important in here. Can you do me another favor? Will you give me some more floss? So now that my patient has bridges, I'm going to show her how to clean a bridge. Oh, I fogged up. Can you cut this in half? Here, let me just. So these are our bridge threaders, or if they have a lingual arch wire band back there, permanent retainer, you're going to use this device. So this is like my needle. See where it has an open end? And then this is my thread, like I'm going to sew. So I'm going to thread my needle. Twist my ends together a little bit, and then I'm going to slide it underneath her bridge. So you're going to kind of poke around in your proximal area to make sure it fits. So I'm just going to go around until it goes through. Pull it through. Once I got my floss in, I'm going to pull one leg through. Now I'm going to clean my mesial area or my distal area of that tooth. And then I'm going to slide down to the other tooth and clean inside that gingiva while cleaning underneath that pontic. And then pull it out. And through it again. She got another bridge over here. So all the retainers or all the teeth, you have to go in between all of them. So if you got braces, you're going to have fun. You're going to be here for a while. You will get frustrated because you're like, man, I got to keep going. So it is a thing to feel frustrated during this process. It's okay because braces, it just takes time. Now imagine your patient. This is one time for you doing it. Imagine what your patient feels like when they do it every day. So it's so important though to keep telling them, because you'll get a braces patient one day that you're going to be like, oh my God, their gum tissue is horrible. Now this is a temporary, so I'm cleaning a little bit gentler under this one because if I knock it off, I have to put it back on. Well, it's been a while. Maybe that's been clean.
They said to leave it alone, so I left it alone. So I have a chance of falling off.
Well, it's surviving pretty well. So it's clean for you. I just took my time. Okay, go ahead and do this again. I'm running out of water. Hook. And that's about it. Okay, so now we're done with our Prophy cleaning. I'm going to sit my patient up and we're going to do fluoride at this point. We don't have technically fluoride in the office, so we're going to basically pretend with Listerine. The reason why we don't have real fluoride is because we don't have a doctor overseeing us. Okay, so if this is our fluoride, I want you to rinse for 30 seconds. Do you want some water with that? Because it's straight Listerine. Sure. Okay. Okay. So 30 seconds, and then when you're done, go ahead and spit it in the cup. While she's doing that, I'm going to pre-clean like a busser because I want to get out and I want to be able to clean fast. So anytime you have your patients or you're doing post-op, great time to start pre-cleaning your operatory, taking everything off. Doesn't matter if it's on your thing, you can get rid of everything at sterilization. I'm going to clean everything out, make sure it's ready. Take my gloves off because I can't go to the front office with my mask or glasses on. Take that away. Oh, take that away. Oh, you didn't spit? I took them away.
I'm like, whoops.
Sorry. She's like, oh, I didn't spit.
Nope.
Okay, any questions about today? All right, so don't forget to change your habit, okay? So your habits really matter and it'll help you clean better. And you have to keep reminding yourself until you build that habit again. Other than that, if you have any problems or concerns, you can always call the office. I'll walk you to the front and you can schedule a next appointment.
Okay.
And that's it.